Spinning is an excellent way to be active while pregnant, but is it safe? When you have a kid on the way, spinning offers numerous advantages and relatively few disadvantages. Indoor cycling has grown in popularity in the last year or so, thanks in part to all of the COVID-related gym closures. A stationary bike in the guest room or a corner of the garage is becoming increasingly popular. When you're pregnant, you might be relieved to be able to work out at home and stop whenever you're done. As more gyms open, some pregnant women may choose to spin in an in-person class, which is also acceptable. In any case, indoor cycling is a low-impact and extremely safe way to exercise while pregnant. Try these guidelines for riding safely while pregnant. 1. Beginners beware. As with most exercises, it's better to continue doing what you were doing before you got pregnant. If this is your first time trying spin, inform the instructor and begin slowly. If you haven't exercised in a while, start with 5 minutes each day until you feel comfortable enough to attend a 30-minute session. 2. Give the instructor a heads up. Especially if you haven't yet shown, says Zeal. When a teacher is shouting at you, it's tempting to push yourself too hard, she adds. You won't have to worry about being singled out if you let him or her know you're pregnant ahead of time. 3. No panting. The ability to hold a light conversation is a tried and true sign that you're working out at a reasonable level of exertion, yet few spinning courses are convo-friendly. Your new rule of thumb: if you're panting or gasping for air, slow down. 4. Stay seated. Anyone, pregnant or not, will attest that standing up during a spin class is far more strenuous than sitting down, which may be too much while pregnant. Furthermore, standing may put additional strain on joints that are already too flexible. 5. Adjust the handlebars. Reduce lower back pain by sitting back instead of leaning forward, which requires you to move the handlebars closer to you. 6. Go halfsies. When you're pregnant, an hour is sufficient, explains Zeal. However, it may be too much for some ladies, particularly if you are new to spinning. A spin class that spends the first half of the hour to spinning and the second half to strength training or yoga is a nice compromise. 7. Stay hydrated. Dehydration can cause premature labor, explains Zeal. She suggests drinking water before, during, and after class up to 20 ounces at each time. What does it matter if you have to pee all the time? 8. Avoid movable bikes. UN stationary devices, such as real rider cycles, that move with spinners, when they lean right or left to train smaller, stabilizing muscles, have been included in certain spin courses. Stick to the old-fashioned bikes that remain put if you find yourself feeling shaky near the conclusion of your pregnancy. 9. Engage your pelvic floor. Engage your pelvic floor during class to support the weight of the baby. I tell my customers that it should feel like you're giving a gentle embrace to your kid, adds Zeal. That added support will protect your low back, and if you do it correctly, you should prevent any pain in that area afterwards, according to Zeal. 10. Listen to your body. According to Zeal, this is the most important guideline to follow when engaging in any type of exercise. Believe in your body. There will be days when you can push yourself more and days when a modest walk would suffice.